Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, respected examiners, judges, and lecturers. My name is Amun Hassan, and these are my girls, my teamwork. Her name is Asi Ibrahim, Ladna Abdullah Ali, Naima Ibrahim, Nimam Hiyuddin, Mitas Ismail. We are from the College of Medicine and Health Science. And today I'm going to present our research entitled Socioeconomic Inequalities in Laboratory Access in Hargeisa, Somaliland. Our supervisor is Dr. Mohammed Chama. Before we actually go too far, our research asks one simple question here, which is, does the person's income, education, and place of residence have something to do with their access in laboratory access? Starting off with the introduction here, first thing first, laboratory access is so much important than we think it is, because doctors depend on laboratory access to laboratory tests, to diagnose disease, to monitor treatment, and most importantly, to take clinical decisions, okay? But the crazy thing here is that not everybody has an equal access to these services. For example, some people, they cannot afford laboratory tests, while others live far away from healthcare facilities. And because of this, we chose to conduct this study because we wanted to understand, does the socioeconomic inequality, socioeconomic factors have something to do with the laboratory access? Coming at number 2, which is the objectives here, we have general objectives and specific objectives. Well, for the general objectives here, our research general objective was, we wanted to assess socioeconomic factors in laboratory access among residents in Hargeisa. The specific factors are, we wanted to determine the laboratory access, level of laboratory access. And by that I mean, how accessible is laboratory service among residents in Hargeisa, Somaliland. And the second thing is actually to assess the associations between socioeconomic factors and laboratory service. And most importantly, we wanted to identify the major predictors of laboratory services. Coming at number 3, which is actually the methods, we conducted community-based quantitative cross-sectional study cross-sectional study involving 3,871 people in Hargeisa. And specifically, we wanted to focus on how laboratory access, how socioeconomic factors such as the person's financial status, the place of residence, has something to do with the access of laboratory services. First thing first, the data was collected using, we collected this data using structured questionnaires administered by the interviewers, and then it was analyzed using SPSS version 26. And then at first we used descriptive statistics, and then we used chi-square analysis to identify associations. And by associations we mean the associations between socioeconomic factors, whether socioeconomic factors are associated with laboratory access. The second thing in here is the data was actually, in here we have chi-square analysis, and last but not least, we used multivariable logistic regressions to identify and to determine the major independent predictors of laboratory service. Coming at number 4, which is actually key findings, we have key findings here. Our study showed that 3,871 residents in Hargeisa, Somaliland, in total, have participated in this study. Okay, when we're talking about our key finding is 32.7% of participants reported easy access. Okay. And 60.1%, which is the majority of the participants, they reported moderate access, while 7.2% they had a difficulty in access. Okay, well, when it comes to our analysis, the p-value of less than 0.5, was statistically considered significant. And what else? Here coming at point 2, our statistical bivariate analysis showed that even though laboratory services exist in Hargeisa, Somaliland, the residents in Hargeisa, they are experiencing difficulty in accessing them. And also, multivariable logistic regressions identified that household income, and the place of residence, geographic residential area, are significantly associated with laboratory access, which means people with higher income, better education, and more favorable residential locations are more likely to access laboratory services. Coming at number 4, which is the conclusions, our study demonstrates that socioeconomic inequalities continue to access laboratory services. And also, what other thing is that, like, you know, people with higher household income, educational attainment, and favorable residential locations were associated improving laboratory service. And I'm gonna give you a pretty cool big picture so that you guys can have a big concept about our conclusion and our study in general. Let's imagine someone like two people get sick at the same time, and then one person has a better education, higher income, and they are, let's say, like they're 5 minutes away from healthcare facilities. And this means that while it goes the opposite for the other person, which means that the people with the same health problem, same medical issue, but different laboratory access, and this is what exactly our study is trying to solve. It's what's trying to like understand. And one last thing, which is the recommendations here, we are recommending that we need to improve, what is it called? We need to improve, financial support. We need to expand laboratory facilities so that people can have equitable healthcare access. And last but not least, we need to increase public health awareness. These 3 things, the 3 recommendations that we have in here, they are not completely getting rid of these inequalities, but at least they can reduce the inequalities and they can improve. They can actually improve and they can increase equitable healthcare access. And we have here the tables and the figures, which is actually like access to laboratory services. And here we have a pi square, what is it called? Yeah, pi square graph. It's talking about that 60% of the 60.1%, which is the majority, they have a moderate access. And while 32.7, they have easy access. And you can see that 7.2%, they have difficult access. And the 1.2% that we see in here, it's actually talking about that, like it's one of the problems. It's like one of the participants, but it's statistically insignificant. And coming at our table, this table is talking about the access levels, going from a certain order, going from the easy access to difficult access. And then here we have like the percentages as we talked before. It's like 32.7%. The other one's like 60.1. And you should know that 60.1, which means that most of participants in Hargeisa, Somaliland, they have moderate access in all laboratory services. And there you go. Thank you so much. If you guys have any questions, you're welcome.